Today we're going to discuss osteoarthritis of the knee. We're going to answer your questions about knee osteoarthritis, such as what parts of your knee are involved, what happens to your knee as osteoarthritis develops, what does your knee pain feel like, when do you have pain, and how does it limit you throughout the day? How do we diagnose your osteoarthritis? What tests are important in evaluating your knee pain? What are the non-surgical treatment options for controlling your knee pain? What are the surgical treatment options for alleviating your osteoarthritic symptoms? Why is physical therapy so important after surgery? And finally, how to prevent and protect against continued knee pain. Let's talk about the normal anatomy or the normal parts list. This is the front view of the knee. We have first the thigh bone, called the femur, and this sits on top of the leg bone, called the tibia. On top of this leg bone, there are two shock absorbers that are called the meniscus. I'm just drawing them in 3 dimensions. The ends of the thigh bone, let's look at this end, have on them a nice smooth surface that's almost Teflon-like, nice and smooth and hard. This is the gristle on the end of the thigh bone. And then the meniscus or gasket is horseshoe-shaped. It's thick in the back, and it's thick in the front. This is the shock absorber, called the meniscus. This is the normal parts list. Let's talk a little bit about the abnormal parts list when we have osteoarthritis. Once again, here's the end of the thigh bone. And here's the top of the leg bone with the two meniscus, both horseshoe-shaped. And what we find is that with osteoarthritis, first of all, the ends of the thigh bone, let's look at this end, start wearing down. And we can have some roughened, beat-up surfaces, some of them with bigger bone chips flying off, some of them with smaller bone chips flying off. This is surface wear and tear osteoarthritis. Then the meniscus, if we draw it here now, has a tendency, especially in the back, to start getting weaker and actually flattens out like a pancake. The front, by the way, often will stay nice and thick. Well, this flattening causes a weakness, which in turn can cause this tissue to tear. And the tear almost always starts in the back. And when that tear is progressed far enough, you can actually develop a little flap when you kneel, squat, sometimes with stairs, sometimes just with sitting. So you can see that little flap separates. The front often stays intact. Again, this is a torn meniscus. Let's talk about the factors that contribute to osteoarthritis of the knee. First of all, family history. Well, there's no specific gene that we found for osteoarthritis, but certainly we know that osteoarthritis has a tendency to run in families. By that I mean that if a parent or a grandparent has osteoarthritis, then you may have a higher likelihood of developing osteoarthritis. Obesity. Well, the higher your weight, the more pressure across your knee joints, the higher the frequency of osteoarthritis. How about previous sports injuries? Well, if you've had an old football injury or an old skiing injury, there's no question that you're at a higher risk for osteoarthritis.
We live in a fast-paced, on-demand world where everything is available at a moment's notice. Now your healthcare can be on-demand as well. Coordinated Health, the name you trust for superior care, now offers Care on Demand, where you can walk in, no appointment necessary, and receive immediate care for all non-life-threatening emergencies. With specialists in primary care, orthopedics, cardiology, and women's health, and locations throughout the Lehigh Valley and Poconos, quality care is never out of reach. Coordinated Health, your prescription for better health. Coordinated Health inpatient hospital and surgical units are located throughout the Lehigh Valley area. We have two 22-bed inpatient surgical units, conveniently located in Allentown and Bethlehem, and an outpatient ambulatory surgical center located in East Stroudsburg. All of our surgical locations are state-of-the-art facilities, hosting surgical services for a wide range of specialties including orthopedics, podiatry, plastic surgery, general surgery, spine, gynecology, and ophthalmology. Our inpatient hospitals provide each patient with a private room, made-to-order meals, and a low patient-to-nurse ratio. Our Allentown and Bethlehem inpatient hospitals have been honored with quality awards from the Joint Commission and have been top-ranking in the state for patient satisfaction. At Coordinated Health, our hospital staff is dedicated to providing the best hospital experience for all of our patients and their families. Would you like to save time in the waiting room? You could complete your new patient paperwork before your appointment. Visit our website at coordinatedhealth.com. Click on the New Patient tab and go to Appointment Checklists. Please select from the list of specialties, download, print, and complete the appropriate forms. Then just bring them along with you to your appointment. Foot and ankle problems happen often. Your foot and ankle pain can result from injuries, poor alignment, medical conditions such as diabetes, or even trauma. When pain occurs, it can seriously impede on your lifestyle. You may be unable to continue playing sports, move freely, or even walk without pain. The Coordinated Health Foot and Ankle Team offer comprehensive treatment of forefoot, midfoot, hindfoot, and ankle pain. We treat simple problems such as bunions, sprains, and fractures to the most complex reconstructive surgeries including ankle replacement. Over-the-counter orthotics, custom orthotics, and diabetic shoes are also available, so you can immediately feel better and get back to the activities you enjoy.
The diagnosis of osteoarthritis depends on careful analysis of your condition. Let's take a look at the common symptoms and how we evaluate your pain.
The symptoms of osteoarthritis are three: pain, swelling, and stiffness. They can all either be present at the same time, or you can see each one individually in different degrees. The pain can either be because of particles flaking off and irritating the lining of the joint, or increased pressure within the bone. Similarly, the stiffness can be because of fluid inside the joint, or it can just be because of increased pressure in the bone because of not having as much cushion there. Osteoarthritis is nothing more than wearing away that gristle on the end of the bone, and instead of having 7 to 10 millimeters of tread, you may have 3 to 4 millimeters of tread. And the swelling can either be because of fluid, which is an irritation to the lining of the joint, or it can be just because of thickening of the lining of the joint, both of which will cause limited motion. The common symptoms with osteoarthritis are more functional. They're difficulty with walking, ascending or descending stairs, particularly descending stairs, where you put more force across the kneecap area. Kneeling, bending, squatting, where again you're loading and compressing the joint at its extreme. And driving, oftentimes, where you have to hold that knee in one particular spot. The symptoms of osteoarthritis oftentimes are made worse anytime the knee is held in one position or compressed in one position for an extended period of time. All of these decrease the amount of motion across the knee and decrease the amount of lubrication. On the physical exam for osteoarthritis, we're really trying to evaluate the nature of the pain, swelling, and stiffness. We are looking for several specific findings. We're looking to see where your pain is located, if your knee is swollen. We test to see if your knee is stiff and if you have weakness or atrophy. The exam consists of trying to localize this discomfort, identify any laxity, and identify any mechanical symptoms, any palpable catching, clicking, or locking that may be present.
An X-ray is the most common study that we use in helping us diagnose osteoarthritis of the knee. This is a normal X-ray of a patient, the thigh bone, the leg bone, this is the front view, and between the two bones, a normal space. It's when this normal space is reduced that we have osteoarthritis, and we'll show that in this next X-ray. Here we have a patient that has osteoarthritis of the knee. This is the front view of the knee, an X-ray that shows the thigh bone, the leg bone, and a normal appearing space between the bones on the outer side of the knee, as opposed to the inner side of the knee where we now see the bones touching. This touching of the bones indicates advanced osteoarthritis of the knee. The other study, other than an X-ray that we can use in helping us diagnose arthritis of the knee, is an MRI. This is an MRI showing the front of the knee. Again, on top is the thigh bone, below here is the leg bone. And now we're able to see between these bones what we call the meniscus. Some people call them the cartilages. On the outer side of the knee here, we see this black triangle that indicates a normal meniscus or cartilage. On the inner side of the knee, we have once again a triangle that is partially black but has white streaks in it that indicate a tear of the meniscus. So this is an arthritic knee, and part of the arthritic pattern is what we call a degenerative tear of the meniscus.
We live in a fast-paced, on-demand world where everything is available at a moment's notice. Now your healthcare can be on-demand as well. Coordinated Health, the name you trust for superior care, now offers Care on Demand, where you can walk in, no appointment necessary, and receive immediate care for all non-life-threatening emergencies. With specialists in primary care, orthopedics, cardiology, and women's health, and locations throughout the Lehigh Valley and Poconos, quality care is never out of reach. Coordinated Health, your prescription for better health. Coordinated Health's orthopedic surgeons use an integrated approach for your orthopedic needs. Whether you've suffered a fracture, are having trouble walking, are experiencing pain in your joints, or have had an injury, our goals are to coordinate all elements of your care, from evaluation to diagnosis and treatment. The focus of our orthopedic team is on your recovery and getting you back to doing the activities you love. Our locations, providers, services, and hospitals are all linked through a single integrated network. Your health records are always available, no matter which of our locations you choose. When you have musculoskeletal pain or problems, choose the region's only integrated hospital network. Our surgeons have performed hundreds of joint replacements in our hospitals. Whether it is an ankle, knee, hip, shoulder, or another joint, our doctors utilize the latest technology and our highly skilled nursing staff to give our patients the most positive surgical experience possible. If you've been injured while exercising, enjoying your hobby, or taking part in sports, our orthopedic surgeons and sports medicine physicians will utilize their experience and resources to treat your injury and help you prevent new injuries. Heart disease is the #1 cause of death in the United States. 1 in every 3 deaths results from cardiovascular disease or stroke. Making healthy choices in your diet and avoiding tobacco products can greatly reduce your risk. If you do need a cardiologist, our cardiologists are here to help and are now accepting new patients. Seeing a cardiologist is a decision to make with your family doctor, especially if you have risk factors such as family history of heart disease, are currently diagnosed with high blood pressure, elevated cholesterol, or are having symptoms such as chest pain. The cardiology department at Coordinated Health is committed to providing our patients with preventative cardiology, disease management, diagnostic testing, imaging, and invasive cardiology services. Please check out our website at coordinatedhealth.com to see videos, obtain information, and to read about our experienced cardiologists.
What's in the toolbox to combat osteoarthritis? Well, the tools we use are dependent on the severity of your arthritis. How do we determine what treatment is the best choice for you? Well, since the treatment depends on the severity, lower grade osteoarthritis respond well to non-surgical treatment. Patients with more persistent pain or a higher grade of osteoarthritis often respond better to surgical treatment. Non-surgical treatment options for osteoarthritis of the knee come down to 3 choices. First of all, there's physical therapy. This physical therapy is done with a focus on decreasing the swelling and stiffness in your knee, improving the range of motion, and finally, strengthening the muscles around the knee. Education on how to minimize impact loading and twisting forces to your knee is also very important. Secondly, we have nutraceuticals. These are naturally occurring substances. These are actually supplements, which consist of either pills or shots. The most common pill form is that of glucosamine and chondroitin. The other pill form is omega-3, also known as fish oils. When we give injections, they're usually hyaluronic acid. This is, again, a supplement. That is, hyaluronic acid is already found in your body. We're simply adding to it. This mimics the natural lubricating fluid that is found in your knee. These injections are given in a series of either 3 or 5 injections over a 3 to 5 week period. While it can take several weeks to begin to feel relief from your symptoms, once you have relief, it can last for several months or even several years. The third category is that of pharmaceuticals. These are medications. Once again, they come in 2 flavors, either pills or shots. The most common form of pill is that of a non-steroidal anti-inflammatory drug. A very common example is Motrin or an ibuprofen. These medications, once again, are used to control both swelling and pain. The injection form is that of cortisone. This is a very powerful anti-inflammatory medication. These injections are typically spaced at least 3 to 4 months apart. Once they're given, they can give relief for several weeks or even several months. Let's talk about the role of arthroscopy in osteoarthritis of the knee. Let's once again revisit the parts list. We have the thigh bone that sits on top of the leg bone. And on top of the leg bone, we have those 2 shock absorbers called the meniscus. With osteoarthritis of the knee, We noted that the ends of the thigh bone become frayed, little chips coming off it, in general kind of beat up. The meniscus in turn tears, most often in the back here, and the tear can extend and worsen. So again, thigh bone, end of the thigh bone, big chips, small chips, rough surface, wear and tear. Osteoarthritis. The meniscus has a tear. That tear often separates when we kneel, squat, sometimes just sitting in the car, so that it looks something like this, where that flap or tear actually separates. The front often stays intact without any tears. So this is a torn meniscus, as we often find in osteoarthritis. With arthroscopy of this condition, our aim is, first of all, to vacuum these pieces and smooth this surface. So we actually have a little vacuum cleaner that comes in, vacuums the pieces, then it turns into a little high-speed planer that smooths these surfaces. So in summary then, step one is vacuum and polish. Step two is to remove that little flap on the torn meniscus and smooth that inner surface. So when we're finished, it looks something like this. Flap's been removed, surfaces have been made smooth. There we go. The front stays often intact. This is step two. Trim meniscus.
Coordinated Health has multiple fellowship-trained radiologists and offers a range of subspecialized imaging services in areas including musculoskeletal, women's, and cardiovascular imaging. We have a variety of modalities including radiography, mammography, and bone density. Advanced imaging services including MRI, CT, ultrasound, and nuclear imaging are also available to help your physician accurately diagnose your conditions. With our digital imaging systems, we're able to provide your physician with immediate access to your studies. Coordinated Health's multiple locations have many imaging options close to home. Appointments are available to fit your schedule. Let Coordinated Health Imaging handle the details for you. We provide the guidance your doctor is looking for to initiate your individualized treatment plan. Rehabilitation and therapy services are an important part of your recovery and can get you back into the game and to the activities of daily living more quickly. When your doctor prescribes therapy as part of your medical treatment, choose Coordinated Health's rehabilitation services. We have extended weekday and Saturday hours to fit your busy schedule. Our therapy services are available in most of our locations for your convenience. The quality of care that you will receive from our therapist is unmatched in the region.
After a knee arthroscopy, therapy is an integral part of your recovery. Physical therapy helps you return to full function so you can resume your normal activities with a pain-free knee.
After surgery, again, we want to make sure the motion and strength come back as fast as we can, and that we try to eliminate any pain and swelling that they'll have after surgery. Again, the patients want us to get rid of the pain as fast as we can, and we want to get that joint moving as fast as we can so we can return them to their function.
Two exercises, quad sets and heel slides, are exercises that we utilize. The next exercise that I'm going to show you is called quad set. I'm going to place the towel behind your ankle here. Okay, what I want you to do is bring your foot back a little bit, tighten your thigh muscle, and you're going to press down towards the table. This exercise focuses on getting your knee nice and extended here, or what we call extension. You're going to hold that 1, 2, 3, 4 seconds and relax.
Things we want to work on right away are making sure the knee is as straight as we can. We'll teach them techniques on how to do passive extension exercises at home with a roll under their foot. We'll work in therapy on quad sets, things to strengthen the quad. We'll also, again, work on bending the knee as well. And again, just mainly promoting motion while decreasing pain and decreasing inflammation. We will eventually move them to activities including weight machines. Weight machines are a strong way to build the muscles. We will obviously tailor that to the appropriate case for each individual patient. The older patients might be more afraid of the machines, but if you keep the weights lighter, you'll actually build more strength, and that will reduce play in the joints, and by keeping the joints more stable, you're less likely to continue the inflammation and the irritation through the joints. It would be beneficial for any age group, provided it's applied appropriately. The patient is doing their own exercises and doing their activities and eventually returning to their lifestyle, so they need to make sure that they're playing a major role.
Most everyone who has dealt with osteoarthritis of the knee at one point or another has said, I don't want to keep dealing with this pain. Whether you've opted to treat osteoarthritis with non-surgical or surgical treatment, you want to protect your knee and prevent further problems from occurring. What your doctor and physical therapist do to help you is only half the battle. You must make some small modifications in your daily life in order to maintain a pain-free knee. Some of those changes include modifying or eliminating the activities that aggravate your pain. You should participate in lower or non-impact sports, such as biking, swimming, using the elliptical, but avoid heavy impact or pounding activities. Continue to perform the home exercises given to you by your therapist. Stretch those muscles surrounding your knee. Maintain that strength around your knee. Remember, you cannot completely stop the arthritic process in your knee, but you can slow the process by modifying your activities and maintaining the motion and strength in your knee. At Coordinated Health, we work as a team in your treatment and recovery. But remember that you are the most important member of that team. You hold the keys to that success. There are no shortcuts. Your attitude and consistent effort during and after treatment build a foundation for maintaining a pain-free knee. In order to maintain that foundation and have a better functioning knee, take what you learned from us and continue to apply it in your daily life. Spend a few minutes a day to stretch and strengthen your knee. This has a tremendous impact in preventing pain and loss of function.